There are various types of litters out there. This video will cover the Talon 2 collapsible hand litter. We will demonstrate how to deploy the litter, move a patient onto the litter, secure the patient, carrying procedures, and how to collapse the litter for stowing. Let's begin. Release the buckle. Pull the handles out fully until the pins lock if they're not already. Together, grab the handles and rotate inward until all the hinges rotate and lock, with the hole in the center of the hinge pointing up. While maintaining the hinges in the locked or closed position, take turns applying steady, firm pressure on the spreader bar with your foot. Watch all hinges to make sure the fabric doesn't get caught in a hinge. Moving a patient can be a difficult task. The more people you have, the easier it can be. You will need 2 people who will roll the patient and 1 person who will move the litter under the patient and maintain alignment of the patient's spine, or C-spine, to minimize the movement of their head and prevent further injury. The leader will give all commands on moving the patient. If you have a device to secure the C-spine, use it now. Remember, roll the patient onto their uninjured side. The 2 rolling the patient will reach across the patient and grab onto the shoulder, belt, or belt loop, and ankle with their arms crossing at the patient's middle. The person holding the litter will bring it closer at an angle so they can roll the patient onto it gently. They will also align the litter so the patient's head will rest on the fabric. If the patient needs a blanket, place it onto the litter now, so it can cover the underside of the patient when they are rolled onto it. The patient can be pulled down or up the litter until they are properly centered. The feet may hang off the end of the litter, but their head needs to stay on. Secure the patient to the litter using the built-in straps. Place one high over the chest and the other either above or below the kneecaps, never on top of a joint. Pull the tail end of the straps to tighten from the direction they naturally feed from. Tighten until the straps are snug, but allow the patient to easily breathe and flex their knees. Secure the tails of the straps. To litter carry, all litter bearers must assume the start position, their knee closest to the patient down on the ground, holding the handle, and their other hand on top of their other knee to push it off. Keep your back straight and lift in unison. The leader at the head of the patient will give the commands to lift. The litter carry can be done with as few as 2 litter bearers. To collapse the litter, first stand in the center of the litter and unlock the spreader bars by kicking each spreader bar outward in the direction of the handles. Then, rotate the poles until the hinges open to allow movement and fold each section of the poles. Collapse the handles by depressing the pin located at the base of each handle. Keep the straps free and tuck the fabric while collapsing the litter. Buckle the litter closed and tightened.